Kyle, who's the medical director here, and I think Jared is here, his co-medical lead as well. So thanks to you guys, and just delighted to be here with all of you. For more than a year now, there has been no greater challenge facing Manitobans than the COVID-19 pandemic. I'd like to take this opportunity to acknowledge the tens of thousands of Manitoba heroes who have helped in our battle against COVID-19, and extend a very special thank you to all of them, to each and every one of them today. Each day, the staff here at CADM have been processing COVID tests, identifying positive cases, and more recently, screening for variants of concern. I want to thank the laboratory technologists, technicians, and the support staff here at CADM who have been on the pandemic front lines since the very beginning. Timely, accurate testing data is critical to ensuring our public health officials have the information they need to help protect Manitoba families. CADM staff have risen to an incredible challenge over the last year, and we thank them for everything they do behind the scenes to fight against COVID-19. Our government's top priority over the last year has been protecting Manitobans. For over a year, we've been making critical investments across government to help Manitobans face the challenges posed by the global pandemic. As you know, tomorrow, we are eagerly anticipating Budget 2021. And with that in mind, I'd like to invite my colleague Scott Fielding, the Minister of Finance, to make today's announcement. Scott? Just put my mask on here.
Well, thank you, Heather. Thank you, Paul and Denise, for coming here today. And thank you, Minister Stefanson. And good morning, everyone. I want to thank you for joining us here. It's fantastic Manitoba spring morning. We've been busy, of course, getting our budget ready for tomorrow. Obviously, COVID-19, of course, is the front and the most important aspect of our provincial budget. Our government's main priority, as Heather had mentioned, is to protect Manitobans and to really advance Manitoba. Again, our government's main priority is to protect Manitobans and to advance Manitoba. Our top financial priority over the past year has been direct critical funding to the front lines to fight against COVID-19. Our COVID-19 plan ensures that we're ready and we're prepared, and we're going to do what it takes to protect Manitobans. That is the utmost priority for our government. Our pandemic response has required unprecedented government support amongst some of the most generous amongst all the provinces in Canada. Budget 2021 will outline our immediate priorities to protecting Manitobans throughout the pandemic and charting really a path forward to advance Manitoba post-pandemic. To continue protecting Manitobans, we are allocating an additional $1.18 billion for COVID response in this coming fiscal year. Repeat, we're continuing to protect Manitobans, setting aside $1.18 billion for COVID types of supports. These funds will support the health, the education, and financial needs of Manitobans as they prepare for future waves of COVID-19 to make sure we're prepared. We are budgeting additional dollars for anticipated costs that's been kind of a nature to all governments over the past while, whether that be things like testing that they do right here at CADM Labs, as well as procuring more personal protection equipment and continue the largest vaccination campaign in Manitoba history. Actual costs continue to evolve, but estimated amounts for the fiscal year include over $230 million for public health responses, including PPE, testing and vaccine site infrastructure and contact tracing. Over $350 million for additional healthcare system costs in preparations for potential future waves to make sure Manitobans and the healthcare system is ready. $160 million for supports for school and education needs over this year and next year. $100 million for full year cost of vaccine programs, the role of the vaccine programs. $40 million for Manitoba Restart Program capital initiatives for the municipal to boost our economy. It's really important. The remaining $300 million will be set aside as a contingency for current unbudgeted expenditures, because we're not out of the woods yet with COVID-19, and we need to be prepared, and that $300 million will prepare us. We'll announce more of our plans tomorrow, of course, in Budget 2021. But before we go, we're going to make one important gesture. You may recall, of course, it's all tradition for finance ministers to buy a new pair of shoes for Budget Day. It's kind of an important tradition in Canadian politics. And what we've done here, and what we've tried to break over the last 2-3 years, or 4 years, or 5 years, in fact, since we came to office, is we're gifting a pair of shoes to someone that's important, an aspect of someone who's important in terms of a deserving Manitoban that will help fight the pandemic support. And this is ceremonial of all the healthcare professionals that have been involved, whether it be doctors, whether it be nurses, whether it be pharmacists, whether it be other organizations. So because we are so grateful of our hard work here today, professionals, I'd like to present some shoes to Chatty. Chatty, of course, works in the provincial labs, and so we're grateful to be a part of this and give the ceremonial shoes to show our appreciation as Manitobans for everything that all healthcare providers are doing, whether you're a nurse or doctor or pharmacist, lab tech, you name it. It's all part of a Team Manitoba approach to keep us safe. So we do have some shoes here, I believe. Eric, if I get you to come over. So Chatty, this is on behalf of our government. I just want to say thank you for all the work that you're doing and all the work that all healthcare professionals, whether you're a doctor, whether you're a nurse, whether you're a pharmacist, that are presenting and helping out with the fight versus the pandemic. Our government will do what it takes to protect Manitobans, and our budget will also focus on advancing Manitobans in so many different ways. So I want to thank you very much, and these are on behalf of our government for the hard work that we do every day here at CADM Labs.
Here. Congratulations, Chatty, and thank you. So thank you, Minister Fielding. Thank you to Chatty. Certainly Manitobans appreciate all that you and your colleagues do here at CADM every day, all that you're doing every day as we face the many challenges of this pandemic. So thank you for all that you do. I know that the almost $1.2 billion budgeted for the upcoming fiscal year will go a long way to protecting Manitobans as we see COVID-19 through to the end. So thank you again, everyone, for joining us today, and we'd obviously be happy to take any questions that you may have. Yeah, there's always challenges with respect to any kind of situation with respect to the pandemic, and certainly I am pleased with the COVID vaccine task force that is put together and doing, I think, very, very good work to ensure that we get those vaccines in the arms of Manitobans. There have been challenges with supply as well from the federal government, so certainly we had a bit of a setback for the next week on Moderna, and so those are the challenges that we face on a regular basis, and we'll continue to take those challenges to ensure that we can roll out this vaccine to Manitobans who need, want, and deserve it. Yeah, the 20,000 capacity is across the province. As you know, we have 5 super centers. We're looking to open more super centers beyond that. We have our pop-up sites. We've got our fit teams. We've got, we've got, many different areas where we're rolling this out. And certainly, sometimes glitches do happen in the system in terms of staffing challenges and so on, and we've addressed those. We've been able to do and administer almost 4,000 each day for the last week, and so I think that that's a very, positive thing for Manitobans. If you look across the country, I don't believe there's other provinces where they have a single center administering more than 3,000 vaccines. So I think we're doing quite well. Obviously, there's challenges, and we'll address those as they come forward.
Will the budget firmly address that staffing issue? Because, as you said, not full-time workers.
Yeah.
So how will the budget, or will the budget, address that staffing problem? That's the weekly change.
Well, I'll start, and Scott may want to address that as well. But certainly, we're ready to ensure that we are fully staffed up to be able to administer up to 20,000 doses a day if we get that from the federal government. So, some of those will be volunteers. And some of them will be staff. So certainly we'll continue to work towards that. Scott, I don't know if you want to add anything there?
No, absolutely. Steve, to your question, absolutely. The budget does reflect that. The amount that we built in really is really to focus on preparing ourselves, make sure we're there. As indicated in the press release, we got over $100 million for vaccine. That's everything that's in place. We've also spent a lot of money in terms of things like PPE. For instance, we've got with PPE some things over almost a year of preparations. The vaccine rollout, if you will, there's $100 million for vaccine sites and staffing. That's a part of that, and we also have preloaded that already in last year's budget. So there's absolutely more money. We based it on our numbers on last year's number and more, and as you may recall from the mid-year report, it was around $633 million allocated. This year we've got $1.1 billion. This really will focus in on protecting Manitobans in a large way, as well as any future waves to make sure we're protected. And that's why there's $350 million for those, and for the vaccines, $100 million. So appropriate levels. And if you compare ourselves versus other jurisdictions that have done recent budget announcements in terms of COVID supports, Alberta for one, and Ontario on a per capita basis, we're spending more, investing more to make sure we're ready.
So how does that $100 million break down for staffing? Because obviously some of that money pays for the product.
Yeah.
And then there's facility rental and all that.
Well, the facility rental, for instance, we've already prepaid under 2020, right, for the super centers and all the other centers that are there. So a good portion of that is the staffing component. I believe in a 3-month period is around $37 million. So we anticipate, there's more than enough money to provide enough staff support as well as vaccine, the sites distribution. So it's a great amount of money. And again, just to follow up in terms of some of the PPE, I'll give you some examples. For N95 masks, we've got over 235 days supply of N95 masks. For gloves, over 521 days of gloves. That's for healthcare professionals. Face shields, 795 days. And so we've allocated an appropriate amount of money, in fact, a great amount of money to support not just the vaccine rollout, but to support Manitobans to make sure that we're protected and also advancing Manitoba as a province. And you'll find out more of those details in the budget tomorrow. Right. I don't have the operational. Heather, maybe you can answer the operational piece on it.
Sure, it's simple. As soon as we start to get the appropriate levels from the federal government. What I will say is that whenever we do get supply from the federal government, that's already earmarked for an individual in Manitoba where an appointment has been booked, or it's for our fit teams, or it's for our pop-up sites, or it's for our First Nation partners up north as well. And so all of those are earmarked by way of appointments or in one of those facilities, obviously the super centers as well, where appointments are booked.
Is there not a way to speed that up with 100,000 doses not being used right now?
So we're booking. Yeah, we're booking appointments based on the supply that we know that's coming that week. And so often, like is the case last week, we got some doses on Thursday that we were not anticipating till Monday. That's fine. That's a good thing. We continue. All of that was the AstraZeneca, which obviously is going out through the doctor's offices and pharmacies. And so they've been busy booking their appointments, and we'll continue to do that. But it's based on the weekly supply that we're expecting from the federal government. Yeah, again, it's earmarked for people by way of appointments as well. So, and it depends on when it actually arrives as well. And so, so those will all be administered through through our super sites. There's so many appointments that have been booked through our fit teams that go out into the communities and to our northern communities. There's obviously by the very fact that we have challenges by geography in Manitoba as well. We are administering out into those communities. We want people to be able to have access to those vaccines as close to home as we can, and that's why we have set up the 5 super sites so far. We're expanding that, and we'll continue to have those fit teams going out to the communities. We'll have our pop-up sites into the communities to ensure that we're offering that vaccine close to the communities.
Well, I'm going to not save some details for the budget tomorrow. Otherwise, Steve, you won't show up at my budget. So I want to make sure you get all those details there. What I can tell you is specifically during a pandemic, Manitobans need relief. We know what the unemployment rate. We know people in a variety of sectors have been unemployed or underworked in so many different ways because of the pandemic. And we need the supports in place as well as relief. And so we think it's appropriate to do it. We see this obviously as a COVID deficit in a lot of different ways. And so we're going to outline a little bit more of those details tomorrow. But we do think that the Manitobans deserve a break. We know that Manitobans need some relief during the pandemic. And that will outline some of the tax measures that we're taking tomorrow. Well, this is made up the $160 million. There's monies that we appropriated last year in about $185 million for the school system. There's monies because the school system is on a different time frame, kind of the budgeting year for it. So we'll provide some more details tomorrow, but it will allocate making sure that people are safe, number one, in schools, teachers are safe, as well as additional supports and substitute teachers and remote learning and those types of items. But we will be identifying more information on that. One thing is clear, that our government is committed to $1.6 billion of additional supports, and that will be made up, obviously, of things like operating dollars and capital dollars. As a government, we're proud of the fact we've committed to building 20 new schools, so we'll be talking more about that tomorrow. That will be a part of tomorrow's budget. What we're talking about here, obviously, are supports that are in place. There's $230 million for things like preparations to make sure testing is in place, PPE and those things are in place. $350 million for things to make sure we're addressing any additional waves that are there, because we want to make sure we're prepared. There's monies that's associated with the vaccine rollout, over $100 million that's associated with this. $160 million for things like schools to make sure that students and teachers are protected, and as well as some safe restart agreement. So there are business supports and relief that will be part of tomorrow's budget, but we're going to talk a little bit more about the details on budget day. We try to do things a little bit different, giving you a snap peek at things that are here. This is a pretty significant amount of money that we're allocating, $1.1 billion to protect Manitobans. And again, our focal point is to protect Manitobans and to advance Manitoba, and that's what this budget will do tomorrow. So thank you very much. Jeff, did you want to final? Yep. No, so we will have, traditionally, and I'm not going to, I'll talk a little bit more tomorrow about it, but traditionally we have had over $100 million for emergency expenditures that have been in the budget. I wouldn't anticipate there be any change to that. There, of course, is the fact that we've got a rainy day investment fund that, of course, was drained by the former government, and so we've replenished it. We used a little bit last week because we needed some business supports that are in place. But the $300 million is COVID to make sure we're protected, right? We've got a lot of contingency that's built into here, $350 million if there's additional waves. We're hoping that doesn't happen, but if it does, we're prepared, and I got an appropriate amount of invested to make sure Manitobans are protected. Any final questions? Thank you very much.